So I guess the most common organic sleep disorder we see at the sleep clinic is sleep apnea, which means stopping breathing during sleep. Most common version of that is obstructive sleep apnea, which is a mechanical problem whereby your throat will collapse while you sleep. So when you fall asleep, our whole body relaxes, which of course is normal. Our throat muscles will relax as well. And so our throat gets smaller and smaller. And that's how we snore, as we're pushing air through this tight space. But in sleep apnea or obstructive sleep apnea, that process goes one step further and our throat collapses altogether. This causes a brief period of choking called an apnea, whereby you're trying to breathe, your body's not letting you, your oxygen starts going down, and your brain realizes you're under pressure, so it wakes you up to open up the throat and get you breathing again. And we all would do this occasionally. It's just how our bodies work when we're going through the various stages of sleep. But in sleep apnea, this is happening repeatedly. And that's a problem because you're not getting quality sleep. Your brain keeps waking you up to get you breathing again. So you are waking up tired, you're sleepy during the day. And the other thing with sleep apnea is that we know that untreated sleep apnea over a long period of time is associated with things like worsening blood pressure control, which of course has its own downstream consequences of heart disease and so on. So sleep apnea, as I said, it is probably the most common thing we see here. It's mostly a mechanical problem, so the fix is also mostly mechanical as well. The most common treatment for that would be something called CPAP, which stands for continuous positive airway pressure, and it's a mask that goes over your nose from nose and mouth, pumps a gentle pressure of air into you to keep your throat open and allow you to breathe continuously while you sleep. For milder forms of sleep apnea, more conservative measures can help. Things like using your mouth guard to pull your jaw forward while you sleep to open up the back of your throat and just give yourself a bit more breathing room. Avoiding certain positions, such as sleeping on your back, which is when your throat diameter is at its smallest. And there are various ways to avoid sleeping on your back, or losing some weight, because weight is probably the most common risk factor at a population level for sleep apnea. In Guy's and St. Thomas's, we do have a bit of experience with some of the newer therapies for sleep apnea, such as hypoglossal nerve stimulation, which we have we've used in just a handful of patients, whereby a little electrical stimulator stimulates the muscles in your airway while you're sleeping at night to tighten them up and open up your airway. But that really is for the select few, and so for most patients, the focus would be on keeping your throat open through various means I've described.